Welcome, welcome. Good morning, everybody, and a happy hello this Wednesday morning. If you are just joining us, could you drop a 1 into the chat so that I can check everything is working as it should be? Anybody out there in desperation? Thank goodness, Tara. Thank you. You know, I'm dreading the day that this doesn't work and I get absolutely no ones. But thankfully, that is not today. All right, I'm pressing buttons and everything this morning. We're cooking on gas. Glorious audience, and I'm expecting, hopefully, a record-breaking audience for Exxon Health this morning. So here we go. As we know, the family continues to grow. I'm based here in Nottingham I was going to say gloriously sunny morning, but it's absolutely brassic here. I'd love to know where other people are tuning in from, how far and wide. So please drop it in the chat. Let me know where you're calling from. As she presses buttons. Jeepers, multitasking. Portsmouth, Norwich, Congleton. Let's see how far and wide we can get. Anybody in Wales? Anybody in Scotland? Northern Ireland, perhaps? Worcestershire? Well, not quite as far, but, you know, it'll do. Ah, Pacheli. Sorry, Pacheli. I think that was right. Do let me know if I got that anywhere near close. Awesome. Right, another question, slightly more probing to keep your fingers warm this morning. When it comes to patient communication, what is your biggest challenge right now? If you could drop that in the chat, that would be awesome to hear about. Sharing is caring, after all. Just got to get back to the chat so I can see if anyone's answering the questions. Come on, 3-word Wednesday. Tell me what your biggest problems in communication with patients are right now. Adesia. Patients reading their communication. I think that's a very good start, Amanda. Very good start. Thank you for joining in. Anybody else? God blimey, all these buttons. Right. Cost of SMS. Okay, we'll keep them coming. And whilst you're thinking about it and getting those fingers going, I'll do the usual bit of housekeeping. Firstly, just to let you know that the call is being recorded for prosperity and sharing. So you're not going to miss a thing if you need to drop off at any point. We aim to keep these things to about 30 minutes. We haven't got a great track record of that, but I'm hoping we'll stick to it today. Second of all, we love questions, so please feel free to drop those in the chat as we go. I'll get to them when we can. We've got a special guest with us today, and he really loves the probing ones, so come at us hard. We love it. We love it. My name's Lucy Glynn. I'm the community manager here at Exxon Health, and with me today, we have the man of the moment, the man on a mission, Mr. Max Gatlin. Where are you? I can't see you within all these faces. How are you doing?
I'm here. Thanks, Lucy. Yeah, very well. Thank you.
Good. There you are. You've popped up again. That's good to see. Thank goodness I'm not here on my own. All right. So just so everyone's up to speed, I think it's worth reiterating the news that we dropped at Best Practice Birmingham. And that is, of course, that Hanley Consulting and Exxon Health have joined forces very happily. We're one big happy family now. And we're going to tackle one of the most persistent challenges, I think it's fair to say, in primary care, and that's the 8 a.m. rush for GP appointments. We say it a lot, but I think that this collaboration is a really strong one because it brings much more powerful technology, more insightful data, and a real range of expert services that hopefully is going to transform access to primary care. We can't get through it all today, Max, because as I've said, we've only got 30 minutes. So what are you going to be talking to us about?
Yeah, I'm going to be talking today about one of the, well, I say newest products, latest products to be added to the Exxon suite, and it's all focused on patient access. So it's a patient-facing tool which gives patients better access, faster time to care, and of course helps us reduce or at least tackle the ATM rush at those busy times in the morning in the surgeries.
Fantastic. I think without further ado, let's dive in. I mean, formerly, this was known as EDATT, I believe, wasn't it?
Absolutely, yes. So everybody on the call, well, actually, this is not a new product. Formerly with Hanley Consulting as a director, we've worked in primary care for well over 25 years, and we established or decided 2 years ago that there was a bit of an issue with patient access, as we very much know. We needed to tackle that problem, and we felt that whilst there was lots of digital tools out in the market that we'd spent a lot of time and money on configuring and integrating with our clinical systems, we recognised that patient usage wasn't as high as it could be. So lots of patients were defaulting to calling on telephones. So 2 years ago, there was about 88% of patients would default to calling. Now we're we're moving in the right direction. It's about 82% of patients will pick up the phone in the morning and call the surgery. But actually what we've developed and deployed over the last 2 years was a product called EDATT. And it was all about enabling digital access to patients via the telephone. And it pleases me to say that we've rebranded. So that product is now called Surgery Assist. So it forms part of the surgery suite offered by Exon. And today we're going to cover exactly what Surgery Assist does. To give you a bit of an insight into where Exon sit in the marketplace, you may use Surgery Connect, which is one of the leading telephone provider in the market. Surgery Assist is the latest product, but it's not standalone. It is a standalone product. You don't need Surgery Connect to use Surgery Assist. And this slide really is just to show you that Exon are not just a technology company and not just a telephony company. They're also adding in layers of expertise to support you as a surgery, as a PCN, as an ICB, to get the most out of the tools that you're currently using. And of course, all of the support that we give and we offer is driven by data. But today, as I said, we'll focus on the Surgery Assist element of the Exon suite. So I'll jump straight in. We've got about 25 minutes left. So what is Surgery Assist? This is part of the digital front door. So you may have deployed online consultation tools. We know about the NHS app. You've got your phones, you've got your waiting rooms. There's lots of different ways patients can access GP services. But actually what Surgery Assist is, it's part of the digital front door. And I'll go into a bit more detail in a couple of slides about where we implement and launch Surgery Assist to add a protective layer to your general practice services. But on the whole, Surgery Assist is available 24/7. It's formed in the interfaces like a chatbot. We call it a digital assistant, but it works with any online consultation tool. We can train it with 200 different community services. It's almost like an automated care navigator to handle some patient queries. So then the humans in the surgery can handle those more complex patient queries or, of course, the admin tasks internally. I'll go into more detail in a bit more detail a bit later around how we can look at reallocation of staff once we implement something like Surgery Assist. So I'm going to spend a bit of time on this slide because I believe that we're thinking about access slightly differently at Exon. That we believe that at the moment, or certainly for the last 2 to 3 years, we've been really focused on all of the demand that's coming into general practice. As I said before, in terms of modes of access, this could be by the telephone. We know 8 out of 10 access points are through the phone. We know we've got patients coming into the waiting room, and we've also moved to online consultation tools. So the last 2 years since the DFOC VC framework, as I said before, we spent lots of time and money and resources on getting these tools set up. But actually, when you look into the data of what level of demand is coming through those tools, we can actually see that some of those requests, whether it be clinical or administrative, aren't really appropriate for GP services. So all of that demand that we're trying really hard to manage within our surgeries, 30 to 40% actually don't belong within general practice. So where Surgery Assist sits in your digital ecosystem within your surgery, lots of you will be very aware of the modern general practice approach. So if we look at it in similar swim lanes, on the left-hand side, we have patient's point of contact, phone, online consultation tool, website, of course. At the moment, that point of contact, and we know lots of patients default to their GP surgery. You are the trusted healthcare provider within their town, village, locality. At the moment, all of that demand is coming straight into you within your practice, meaning that your staff, your team are having to manage those requests. And again, if we look at the data above here, we've looked at the data, and 30 to 40% of that demand that's sitting with you that you're trying so hard every day to manage actually doesn't belong in general practice. So at the moment, when that when that request comes in, we're having to manage that internally. And of course, with the move towards more integrated neighbourhood teams, we're trying to, with the installation of care navigators, we've all got our local Bibles, our directory of services. So all of that demand that's coming in at the moment, your staff are having to receive it and respond to it. And of course, that includes, I think Oliver mentioned SMS costs are a bit of an issue with patient communication at the moment. So 30 to 40% of your demand coming in, let's say you get 2,000 queries a week potentially, what your staff are having to do is then send back a response to that patient to signpost them elsewhere. Okay, and at the moment, that is how general practice is operating. We've got no filter or layer of protection between the patient's point of contact and our GP staff on our services. when actually, when you look at the data, as I said, just under half of it actually doesn't belong in general practice, and we can signpost it back out, whether it be a community service, a PCN service, or my favorite tool and solution to demand and access is self-service. There's so many digital tools out there. The NHS app is absolutely brilliant. If we can focus on empowering patients to use those tools and self-serve, it will instantly reduce that demand coming into general practice. So what we recommend, and we're advising more and more at the moment, is a bot-first approach. I know that bot potentially could be a dirty word to some of you. We can call it digital assistant. But for efficiency, a bot-first approach allows an extra layer of protection before a patient comes into general practice. If, of course, that patient meets the digital assistant and they express the need for a clinical assessment, we can then pass them through to your online consultation tool. But what we're getting at the moment is lots of inappropriate and unnecessary queries coming into our online consultation tool that we're then having to manage. And again, I'll lean into the community element. Lots of those belong at PCN services or community services, and we're having to actually receive them and signpost a patient away, when actually by introducing a bot-first approach with Surgery Assist, that can do that care navigation for you automatically. And in turn, that would give your staff much more time to handle more complex patient queries, or indeed reallocate them to preventative and proactive care. And it's those kind of care models that we need to focus on to improve health outcomes for the nation. So I know I spent a bit of time on this slide, Lucy. And I don't know if there's any relevant questions that have popped up because of that. I know it's a bit of a new approach. It's not new for us. We've been deploying this approach for the last 2 years, and some of the data that we've got from it is absolutely astounding in terms of resource allocation or reallocation. We're retraining staff now. We've tackled and solved the ATM rush in at least 80% of our surgeries. They're answering the phones within a minute. So then what we're doing is taking people from the phones and focusing them on preventative care. Sorry, Lucy.
Well, I was just going to say, and there have been some incredible stats on that, which I'm sure we can share at a later date, Tudor Lodge being one of the more obvious case studies. It's all very in keeping, isn't it, with the government's plan, the 3 steps, preventative, mine's gone blank all of a sudden, analog to digital, and the preventative model over the reactive one. But I'm just picking up on a point that Renee's made in the chat. Patients often feel more assured talking to us rather than reading messages. With a bot-first approach, what would you say to Renee?
Yeah, absolutely, and that's not wrong. The patients that speak to you will tend to say that to you, but it's the patients that aren't speaking, that don't need to speak to you, that are happy to self-serve. So we do speak to patients on a weekly basis, and actually by going bot first, and I'll show you the pathway and how that works in a couple of minutes, but we're giving patient choice about going digital. Those that choose to go digital can go digital, which in turn removes them from the queue. So those that cannot access digitally or need to speak to a human are getting through much faster. And that's where we look at the time to answer phone calls. We're not only cutting it in half, we're reducing it by 60-70%. And we've got some case studies that we can, of course, share when we share the webinar afterwards. But it's a very good point. We've got patients that want to speak to us. Absolutely. What I would say is that person no longer needs to wait 10, 12, 14 minutes. They'll be getting through in 4 to 5 minutes instead of waiting in a queue. That would be my response. And of course, on the slide I showed at the start, Exxon are now going to support you with doing surveys to find out what your patients actually want, and we can support you and design a solution or a framework that would fit your demographic.
And of course, they don't have to sit in a queue. They can also get a patient callback. Timely drop. Another question from Lindsay, which is a good one, around tech and which services this works with. The question is, does it work with Anima? But I guess the question is, does it work with what other tools does it work with?
Yeah, absolutely. I mean, in our approach, we are leaving no surgery behind in terms of digital adoption and uptake. We integrate with every single supplier, so we're completely systems agnostic, regardless of which telephone supplier you're with, online consultation provider, or even website supplier. So we can integrate with them all. Of course, if you're a Surgery Connect customer, we've got a bit more of shared development resources, so the integration could be a little bit deeper. And I'll go through the patient pathways a little bit later. But yeah, completely systems agnostic. This can be procured by any surgery in the country.
And just to reiterate that, they really don't have to be Surgery Connect users. So I think that's fantastic. Okay, sorry, Max, back to your presentation.
Lovely, thank you. So yeah, we touched on it there about how patients will access the digital assistant. So we've all used it. Is a website chatbot. So we surface digital assistant on the website, which is there to support your patients and navigate them to the right to the right care service, whether that's within GP, as I said, in the community, even pharmacy. I know that question is probably on everybody's mind. Yes, we signpost directly into pharmacy via the pharmacy first route. So we can access on the website. We also send out, and this has been a hugely, I mean, I was very surprised actually in the uptake, but we do send you branded posters for your waiting room. So if you've got patients that are still ordering scripts via paper, they're coming in and putting it in the post box in the waiting room, and your staff are having to manually process those. We actually launched, had a program where we sent out posters to every surgery. So above your prescriptions box, did you know you can now do this online? QR code that takes you to a digital assistant, and then the digital assistant can actually support that patient downloading the NHS app if they need to, getting set up for their repeat meds or any other online function that they need to use. Of course, with Surgery Connect, you get, you can see in the center of my screen here, the patient now gets a text, a live text update of where they are in the queue. And what we're doing is going into your Surgery Connect admin console, and actually we can embed a link to the digital assistant within that text. So if a patient joins the call queue, we'll say, yeah, you're 19th in the queue, but while you wait, why not try our digital assistant? And then because of Surgery Connect's amazing integrations, once if they've solved their problem within the digital assistant and they've self-served, because that's what we're all about, is empowering the patient to self-serve, to remove that burden from your workload, they can then go back to the SMS and cancel their callback. And we're seeing this more and more as we go live with the the callback option within Surgery Connect. And again, the largest use, as I said at the start, 82% of patients call us. So naturally, we would work with you to go into your telephone system, look at your call flow and your IVR messaging. Where can we offer patients to self-serve? And actually, we do it across every option within your telephone menus. So if a patient calls in and clicks 1 for appointments, we can say, did you know you can now do this online? Please press option 2 to receive a text. We can ping a text out to that patient. And yes, that text stays on that patient's phone. And 40% of our digital assistant users are returning users directly to the chatbot. So they're actually not calling back. They're going through the digital assistant directly from their mobile phone. And again, I'll show you on screen an example of that. So the patient interface, it's always surgery branded. So we would have the banner in your colors. We would create a personal avatar for you. On screen, I think you've got Southwest London's version of Dot Cotton. I think we designed a non-smoking Dot Cotton was the brief, and I think we nailed it. But there's all sorts of avatars, and it's actually amazing how much an avatar improves patient engagement and adoption. You know, I'll show you an example in Liverpool where we've developed Caprice, our poster girl. She's across 5 surgeries, borders 2 PCNs, and I think they're talking about a 5-foot cardboard cutout for the waiting room with a big QR code that patients can come in and speak to. So yeah, we do fully get involved, and patient engagement and adoption is at the forefront of what we do. So we would work with you as a surgery on that. It's not just about how it looks, it's how it works as well. So we don't just customize the banner and the images, we customize every single flow or pathway within the digital assistant, because we know your surgery will operate differently to the one down the road and the one over in Liverpool or Essex and Manchester. So we work with you. Our deployment team is fantastic, and one of our kind of key specialisms is we work with you, and your digital assistant is trained just like your best receptionist or care navigator. It knows all of the community services available. It knows all of the PCN services you work with, and of course, it knows all of your online forms. If you're not on online forms yet and they're all PDF'd, we'll make them digital for you, and we can embed them in the chatbot. So you don't need to do any scanning or printing, or the patient doesn't need to come into the surgery to drop anything off. We are fully enabling the patient to self-serve digitally. I know there's a lot of information there, Lucy. Is that clear?
Yeah, it's crystal clear to me. I think, which is always a good sign. I do think we need to just skip back and do a couple of questions. There's some good ones in the chat. I've got one that was asked prior to the webinar as well, which I think is important at this juncture. And that's, with all the technology that's available, are patients ever confused? Are they going to get confused where there's too many tools available?
Yeah, my immediate answer is patients are already confused. This is solving that problem. So we ran a survey of 85,000 patients back in 2022. Lots of you will remember the enhanced access surveys that we were all commissioned to do. We worked with 7 PCNs across Buckinghamshire, asked patients not only what time would they like the surgery to be open, 6 to 8 on a Monday, 9 till 12 on a Saturday, but actually we added a few more questions around digital. So did you know you can access GP services online? Do you access them? If you don't, why not? And the overwhelming response from that was, I just don't know where to go, let alone what to do. So there's lots of comms from, national, regional, right down to surgery level, where we're telling patients that you can do this on the NHS app, or to go back to the question earlier, you could go to Anima for this. If patients are confused, so there's two things. If patients are confused, they will call. We've got a big banner in the office, confusion equals calls. The other one is barrier. So if a patient goes to the NHS app and doesn't know how to set up an account, or they go to online consultation tool, they need to set up an account again, that barrier will lead to them calling. So what we've done with the digital assistant, you don't need to log in. You can access all of the features that the digital assistant offers. You don't have to log in until you need to integrate with the system or a third-party supplier app, but then the digital assistant can support that patient in accessing it. And again, to answer the question, confusion, absolutely not. Take a bot-first approach. The bot will know where to send the patient as and when they need to go. So if a patient does need a clinical assessment, we'll say you need to go over to Anima, eConsult, Patches. If they need to see a health and wellbeing coach, the chatbot will say, there's actually a form here where you can self-refer to one of our PCN services. So actually, we're eliminating that level of confusion.
And to stick with that theme, is everything saved to the patient record?
Yeah, that's a great question. So at the moment, what we're doing on a monthly basis is exports of conversations. So we don't have that level of integration with the clinical system, but that's all coming in very early in 2025. At the moment, we're not doing any clinical consultations within it. As I said, we use the third-party apps. So we're all about getting better, more appropriate use of the services you already have, and allowing the patients to connect to those services.
Okay, question from Shannon. Can this work as a standalone add-on with Surgery Connect, or do we need to keep AccuRx for responding to patients?
It's a great question. It leans into more of a, so AccuRx offer multiple different products. In terms of online consultation and triage, we're not doing that within the chatbot yet, and I won't say too much about that. But on the other hand, AccuRx also have a batch messaging or an individual messaging, which if you joined us on our last webinar, is now or soon to be available within your Surgery Connect phone bar. So dependent on which AccuRx feature you're alluding to, we'd have a conversation with you. So when you speak to your regional manager, we'll do a direct demo, look at your systems. What do you need? What do you not need? We'd have to look at on a case-by-case basis that we would do that. Hopefully that answers. Sorry if it was wishy-washy, Lucy, but
no.
Hopefully it helped.
Shannon says thanks, so I think she's happy, which is the important part.
Okay.
Another question: can this assist with patients who need to send us forms to complete, such as a travel insurance claim? Currently, AccuRx doesn't allow patients to send us forms without an online consultation interaction first. Yeah,
it's a great question, and absolutely. So we would look at what your current process is. Again, if you already have a tool that's using SNOMED coded forms, so I'll lean on the SNOMED coded forms with integrations. So there's tools with certain website suppliers that might offer SNOMED coded forms. We don't want to increase the number of requests or avenues or channels that you're receiving information. So if you've already got digital forms available, we would embed those within it. If you don't have digital forms available, we'll create them for you and make sure they're going to the right place. So one-off medications will go to your prescriptions inbox. Proxy access requests might come into reception. So yes, absolutely, we can surface all of these digital forms for you within the digital assistant.
And to all of those that are struggling to access the chat, please feel free to put your questions in the Q&A section. I am looking at that simultaneously, believe it or not. We'll get to cost, don't you worry, but I know Max just wants to show you a little bit more about the service before we get to that.
Yeah, thank you, Lucy. Absolutely. So I just wanted to make sure you understand, as I said, 82%, that's just over 8 out of 10 touch points with our surgery come through the phone. So the obvious place to start was integrate with the phone systems and allow the patients to choose whether they want to come out of the call queue and self-serve, or they really need to speak to a human. So what you'll see on screen is a smartphone, an iPhone. This is a patient calling their surgery. Let me know if there's any issues with the quality. So the patient will be met with your menu options, and of course in our deployment, added expertise, we will do an audit of your phone system. Sorry, I've switched on a bit there. So 1 for appointments, 2 for test results, 3 for prescriptions, and so on. So this patient has opted for 1 for appointments, and the IVR message that we've then changed it to is, did you know you can now book, check, and cancel appointments online? Please press option 2 to join the call queue. 2 to receive an SMS to self-serve, or 3 to join the call queue. And this patient is more than happy to self-serve, presses option 2, and then the phone system automatically triggers an SMS to the patient where the patient can come out of the call queue. Absolutely, they can stay in the call queue, but when it comes to deployment, a lot of surgeries are saying, if the patient wants to self-serve, let them self-serve. We'll remove them from the call queue. But it's really important at this point, as you can see, we've got Whitehill surgery. It wouldn't be our branding. Again, it would all be your branding, your avatar or your color palette. It's really important for us that the patient feels like they're still part of the surgery ecosystem, which they are. We know going back to COVID with the SMS scams and so on, it's really important that we build in that the surgery branding that you have. So this patient has then come out of the call queue. They can click the link to launch your digital assistant, and then they've got their very own personal digital assistant there at Whitehill surgery with a list of options. It's a slightly older video, so I want to show you a little bit more, a few more examples of how we're apologies.
Piping under pressure. It's always
should
fun.
have preloaded that. Yeah, sorry. So if we go to Southmead surgery, for example, you'll see digital assistant Ella, and Ella will welcome me and then offer me some indicators into where I need to go or what I need to achieve. And then there'd be some self-serving pathways, or there may be some signposting pathways, as I said, PCN, community, or into the GP surgery. And just to stick on the theme of branding, let's go up north to Liverpool, where we've got Dr. Masarani and partners, and you get a sneak preview of Caprice. And again, you'll notice I'm welcomed by Caprice, and again, slightly different menu options because every single digital assistant is built to suit your surgery, your needs, not only of your staff, but also of your patients. And again, if you've got any campaigns running, for example, flu, if you're doing women's health or NHS health checks, we can put those on the front of your main menu, and patients can access those services better. One here with Caprice was Leave Feedback, so that takes them straight to a friends and family test. So all of the things that you're required to do, there's no need anymore to send out batch SMS to all of your patients. You no longer need to say, send 15,000 SMS fragments to your staff at 6:30 on a Wednesday and say, please view your test results in the NHS app. There's no need to do that. If your patient is calling the surgery or visiting the website to view their test results, the digital assistant will help them self-serve. So you're saving, again, going back to Oliver's point about SMS costs, we've had lots of conversations with the national teams around this. A bot-first approach will reduce, I don't even want to put out a number, but it will reduce your SMS use significantly.
Well done for resisting. A couple of questions in the Q&A. We already have Ask First online triage tool. Can this direct patients in the queue to Ask First if they do not want to stay in the queue or use options offered within Surgery Assist?
Yeah, it's a very good point, and we're live across lots of Ask First surgeries. And again, we don't do clinical assessment. We're not a clinical triage tool. Ask First is a fantastic clinical triage tool. At the moment, again, the patients still have to create an account with Ask First. So what we would do is if a patient comes through the digital assistant and they express the need for a clinical assessment, and they may need to create an account in Ask First, our digital assistant wouldn't just signpost them there, but it would help them download the app, because I know that that's an app, and also not what we do in the digital assistant as well is we don't have to ask the patient, are you on an Android phone or an iOS phone? The digital assistant recognizes the device the patient is on. So go back to that eliminating confusion, and it will take them to the correct app store to help them download the app. And then it can guide them through with online guides to show how to create an account. So my first answer would be, because we did a study on this in Tudor Lodge in Southwest London, patients that were sent a text directly to an online consultation tool from the phone, only 51% of patients ended up booking an appointment through the tool. That was from intent to outcome. So 100% of that intent was was appointment, 51% got appointment. So patients think they need to go to AccuRx to book an appointment, which is why I think we need to add an extra layer of protection to just make sure the patient actually needs to submit a clinical request, because they may not need to. So rather than send a link straight to Ask First, I'd send them a link to the digital assistant, and if appropriate, we'll send them to Ask First.
Another question from David. I knew we were going to run out of time on this one. If patient accesses the website to speak to the chatbot, how will they then be added to the phone line if they need assistance by a staff member? So kind of the other way around, I guess.
Yeah, that's a fantastic question. So luckily I've got it on screen now. I would have loved to show you an iPhone screen. So we're just showing a web widget at the moment. And I'll flick through a couple of options within here, and I'll just show you what we can do there. So we can open up free text. I won't go down the AI route at the moment. Probably save that for another webinar, Lucy. But if anybody has any questions, please speak to your regional manager, myself or Lucy directly, and we can go through everything that's coming regarding AI, systems integrations, etc. But for now, I'll just show a quick example of signposting. So if a patient expresses the need or desire to quit smoking, the bot has been pre-trained, this one's in Buckinghamshire, to signpost the patient straight to Be Healthy Bucks, and they can click the link and self-refer. Okay, so it's not coming in through your OC tool for your care navigator to worry about. If the patient, very straightforward standard symptom, if they express the need for a clinical assessment, we would signpost them back through the appointments option or surface your OC tool right away. Now, to get to David's question, if the digital assistant doesn't have an answer or the patient needs further support, I'm just throwing it off here. I know I haven't trained it to respond to this one, but then you'll notice an extra option, request callback. So with Surgery Connect at the moment, we're talking to other suppliers to integrate to this level. But if the bot cannot handle the patient's query or doesn't understand it, they can request a callback, put in their phone number, date of birth, and their surname or full name, and they'll be joined to the callback queue within the Surgery Connect phone system, which is really, really exciting, because you're absolutely right, David. If a patient called the surgery and got told to go to a digital assistant couldn't help, and then we tell them to call again, not a great patient experience. As I said, the patient is at the forefront of all of our thinking, so we've done that integration for the patient's benefit. And yeah, we will be rolling that out across other telephone suppliers, hopefully in 2025, but we can pick that up on a direct call. Another thing I wanted to add is, of course, I mentioned I hadn't trained the digital assistant to recognize this question. So what we do to train your digital assistant locally is we work with you to upload 200, 300, 400 FAQs. Don't worry, it's not very difficult for you. It takes about an hour of your time. We recommend responses and you can just tweak them. But we train the digital assistant. Of course, we don't always anticipate every patient query. So in this example here, I don't know what to do. We didn't anticipate that, so the bot hasn't been trained within the response. So what we store this as is a UAQ. This is a unique asked question. We have a bank of UAQs. And because Surgery Assist is very much a managed service, you'll have a half-an-hour meeting every month to make sure your digital assistant is up to date and aware of all of the ongoings within your surgery. Within that meeting, we will say, hi David, you've got 26 UAQs from last month. One of them, for example, is, I've just found out I'm pregnant, what do I do? As a surgery, how would you usually respond to a patient that asks that query? We fill it in, we flip the UAQ to an FAQ, so that digital assistant then learns a further 22 responses. Give it 3, 4, 5 months, your digital assistant will recognize and be able to respond to 2,000-3,000 complex patient queries. So it's really all about, let's keep it upskilled, let's keep training it, so that we can really answer lots of complex patient queries. Another reason we do the monthly meetings is we know, unfortunately, some of the community services, such as charities, get decommissioned or deprovisioned. We would just need to remove those. And new ones that get started up, we can add those as well. Sorry, I'm blabbing on lots of
No. I'm just very conscious of time and the fact we're 4 minutes over already. But hopefully that answers Katie's question, who asked about Pharmacy First. It's all about localized training. So I was just going to ask the question, actually, because it's come up, does the bot respond to accessibility tools? And, just around that, does this help with accessibility, I knew I would be able to say inclusivity.
Yeah, absolutely. So all of our guides and our training guides, and we'll go through in more detail on a direct demo with yourselves, they're all CAD compliant. In terms of accessibility, we've now got an accessibility widget. So we can go into dyslexic friendly. We can go into grayscale mode. We can do all of that within it. We can increase and decrease the size of text within the digital assistant. And of course, in terms of accessibility around a language element, we are just piloting with a couple of surgeries in the south of England some multilingual queries and responses. So whilst we're training the digital assistant in English, it's actually able to respond in there's 5 primary languages we're going with, which are the most used language other than English that is requested with your interpreters. And then we'd work with you as a surgery to make sure it's safe and secure. We're working with Curistica as our clinical safety partner on all of that testing. But in terms of accessibility, yes, for visually impaired, for increase and decrease text for WCAG, but also around languages, we're piloting that now, and that'll be coming early 2025.
Fantastic. Gosh, I mean, the questions have been flying in, so I'm hoping we've covered most of it. My advice to you, though, if you are still feeling like you've got some questions, is to jump on a call with your customer relationship or your client relationship manager. Pop your ODS code into the chat if you would like us to reach out to you to talk through Surgery Assist and all the goodness around that a little bit more detail. I am going to wrap this up at this point, Max. Is there anything else you want to slip in before we go?
I touched on deployment a little bit there. There's a bit of hesitancy across primary care and general practice. I come from a digital transformation background within primary care. I know the pain. I've worked within general practice. We've rolled out lots of online consultation tools and done those integrations. We know it's very labor intensive for you. So we've developed this solution to be very light. So in terms of workload for you, whilst we can deploy within 5 to 6 weeks at the moment, it's very hands off. So it's very fluid. You complete an online form. We have an hour meeting. We can build your prototype, and then we can get it into testing within 3 to 4 weeks for you. So it's really light in terms of deployment, and we do all of the work in your phone system, on your website to get it live as well. So I just wanted to add that. I know the struggles, and we've built this in such a way that we remove that difficulty.
I think it's also circling back to cost, because I did say we'd cover that before the end of the call, and we haven't. Rennie's just reminded me. Thank you, Rennie. What is the cost of Surgery Assist?
So yeah, I mean, it's how much would removing 40% of your demand in general practice mean to you? At the moment, we're going down a cost per patient model, so it's 30 pence per patient. That's inclusive of all of the data dashboards and reporting, which I know will be covered on the next webinar, Lucy. Haven't got to go through it now, but yes, it's again, how much would removing 40% of your demand mean to you? Being able to reallocate staff, retrain staff, improve staff morale and well-being, and reduce turnover, and then get staff focusing on preventative and proactive care. We're more than happy to give references from our sites that we've deployed across as far north as Liverpool, south to Devon, east to Essex, and west to Herefordshire, and of course we've got a very strong hold in the centre of the country in London as well.
Okay, right. I think that's answered the question, Max. Thank you for that. But as I say, if you do want to follow up on this and just have a non-committal conversation with your CRM, pop your ODS code in the chat, and we can dive into more detail and look at costs for your surgery. Just to let you know, we're looking to gather again. Yes, Stephen, the webinar will be available. I'm just about to tell you about it. We are going to gather again on the 18th of December for our next webinar. As Max has alluded to, we're going to be diving into the thrilling topic of data. It's on everyone's lips, so it's about time we talked about it. Dashboards and telephony usage of data, demand and capacity, etc., etc. There's loads to get into, so no doubt we'll run over there as well. Apologies for that from us today. That is it from us. Hallelujah. I hope you've enjoyed it. We do appreciate all of the. There we go. Peter's telling you directly. Great demo, Max. Thank you. I absolutely concur. I hope you've enjoyed it. Thank you all for your ongoing participation. It's been great. If you'd like anything further, pop your ODS code in the chat and we will get to you, I promise. We will make the recording available to all registered attendees for the webinar. It'll have all the relevant links. Hopefully we'll touch on a few of the questions as well. Hopefully we'll see you all again next month, sorry. In the meantime, though, on behalf of all of us here at Exon Health, have a happy and healthy November, and we will see you next month for more. Take care.
Thank you all. Bye-bye.